All right, welcome back, Space Coast. We are here at the Holmes Regional Medical Center blood drive, and I'm joined by one of the spokespersons here, Lance Skelly. If you could just tell us about today's event today and kind of how the turnout has been here so far.
Let me start by saying thank you to Space Coast Daily and our media partners around the area. So yesterday we put out a call for blood donors in partnership with Life South. And the response has just been overwhelming. We maxed out all of our slots within a couple of hours. And so I just want to say thank you to your team for helping make that happen and to our community. But today, this is all about giving back to our community. As some of you know, there was a data security issue affecting one of our blood donor supply companies, One Blood, about a week ago. Severely impacted their ability to get us blood. And so we did many of the things that we needed to do to keep operations and keep our patients safe, but blood donation is critical. And so today, another partner, Life South, is here taking blood donations. And the best part about this is half of everything we take in today, they will give back to Health First. So you're talking about 70 to 75 servings of blood for patients that is just critically needed right now. So again, the turnout has been fantastic. The response, partnering with Life South, which is not our typical blood donor supply company, shipping in and doing this and coming where it's needed the most has been amazing. So we're super thankful for that as well. So great response, great day. This is great for our community.
Absolutely, and you can see everyone working hard in the background. What does it mean when you see the community come together, like you said, and then seeing the team at Health First really help out and make sure that the objective is done, and that's to ultimately, get the urgent blood donations in, and that's exactly what's being done here today.
There's not enough words. So this morning, the team started setting up early this morning. Our executive leadership team was here at 8 o'clock.
Wow.
Our CEO was here. Our chief medical officer was here. Our chief experience and administration officer was here. Our CEO for our health plans was here, all rolling up their sleeves to give blood. They were first in line. So they've been on the front lines of taking care of our patients in our community over the last week. And when the need arose, they were the first ones here to roll their sleeves up to make that happen. So that's truly inspiring. So throughout the rest of the day, we're going to see a lot of our other associates that are going to come in. People from our community are going to be here. We're taking walk-ins. We actually had a lot of associates who actually missed the boat at first. So once they filled, they were disappointed. They really wanted to get involved. And so we'll take whatever we can get today in terms of walkthroughs and walk-ins. But the response has been met and then some. So it's been amazing to see that.
Absolutely, we love to hear it. And let you go. Any final, message to the community or thoughts before we let you go?
I'll just say, so again, today, this is Life South that we're with. They don't typically serve this area.
Yep.
They picked up the baton and they came over here to make this happen. So we cannot thank them enough. Next week, we're going to have One Blood is going to be back in their big red bus. So we'll have 2 more drive opportunities at our hospitals next week. So people can be on the lookout for that. Those are more opportunities to give. So again, just there's never not a need for blood donations. So this is a critical time. But at the same time, we're always in need of blood. So if you have the capacity and the ability, we just ask to give blood any time of the year.
Is there a certain blood type that may be, a little bit needed more than the other?
All of them.
Okay.
Right now, most especially, we're in need of platelets. And as you probably may or may not know, platelets help clot the blood when there's a bleeding issue, whether it's a gunshot wound or a severe car accident. Those platelets are what's needed to stop the bleeding. And so we're in desperate need of those. But we need all sorts of blood. So any type, we'll take it.
Awesome. Well, we appreciate a few minutes of your time, Lance.
Thank you.
We appreciate you and Life South really helping the community in such an urgent time here.
Again, we thank